Hello, this is Dr. Ruby. Welcome to the second lecture for Module 6, Types of Joint Motion and Musculoskeletal Assessment. On this slide, please view the objectives for Chapter 16, Section 1. Again, use those objectives to help you study for the quiz. Here are additional objectives. There are two types of motion, or range of motion, that can occur at a joint: active range of motion and passive range of motion. Active range of motion is defined as joint motion that is created by the mover muscles of that joint. Passive range of motion is defined as joint motion that is created by a force other than the mover muscles of that joint. Because active motion is created by the mover muscles of the client's joint that is moving, active range of motion must be performed by the client. This illustration shows active joint motion in which a person is actively flexing the right arm at the shoulder joint. A therapist can have a role in performing passive range of motion of a client. Passive range of motion can be performed by either the client or the therapist because the mover muscles of the joint that is being moved are not creating the joint motion. The illustration on the left shows a therapist flexing the client's arm at the shoulder joint, and the illustration on the right shows the client using his left upper extremity to flex his right arm at the shoulder joint. In both cases, the mover muscles of flexion of the right arm at the shoulder joint are relaxed, and passive range of motion is occurring. In addition to active range of motion and passive range of motion, a third type of motion, called joint play, also occurs at joints. Joint play is the small amount of gliding motion that is permissible at a joint at the end of a joint's passive range of motion. Two types of manipulations are possible within the realm of joint play. One type is shown in the illustration on the right. This type is a low-velocity, long lever arm stretching of the joint. It is sometimes called joint mobilization. The other type is a high-velocity, short lever arm manipulation that is an adjustment and is used by a chiropractor and an osteopath, and a popping noise often accompanies joint adjustments. Whenever a joint motion is started actively by the client and then is completed passively by momentum, that motion is known as a ballistic motion. Most motions of the body are ballistic because ballistic motions are very efficient. A ballistic motion allows muscles that actively contracted to initiate the joint motion to relax while the momentum completes the motion. An example of a ballistic motion is the normal swing of the upper and lower extremities of the body while walking. When evaluating joint motion, it is important to feel for and assess the quality of motion at the end of a joint's passive range of motion. This is important because the quality of the end feel can alert the therapist or trainer to whether the joint is normal and healthy or pathologic. There are different types of end feels: soft tissue stretch, soft tissue approximation, bone to bone, muscle spasm, springy block, and empty. Resisted motion occurs when a resistance force stops the contraction of the muscles of the joint from being able to create motion at that joint. In this instance, an isometric contraction of the muscles of the joint occurs when that resisted motion is performed. The force of resistance that stops motion from occurring can be provided by the client or the therapist. The pictures on this slide show both possibilities. The resisted motion shown here is flexion of the right arm at the shoulder joint. There are several test procedures for musculoskeletal assessment: active range of motion, passive range of motion, and resisted motion. Most musculoskeletal conditions result from an injury to the musculature and associated tendons of a joint or to the ligament joint complex of a joint. Injuries to the musculature include strains and tendinitis. A muscle strain occurs if a muscle is injured and torn. Tendinitis results from an injured tendon that is inflamed. Sprains are the most common injuries to a ligament of a joint or joint complex. A sprain occurs if a ligament or joint capsule is injured and torn. When the active range of motion of a joint is tested, both the mover muscles and the ligament joint capsule complex are stressed. Mover muscles are stressed because they are asked to contract concentrically to create the joint motion that is occurring. The ligament joint capsule complex is stressed because the joint is moved, causing stretching or compression of the various parts of the capsule and ligaments. Therefore, a test of a joint's active range of motion would be expected to generate pain for most musculoskeletal injuries of mover musculature or ligament joint capsule tissue. When the passive range of motion of a joint is tested, only the ligament or joint capsule complex is stressed. The ligament joint capsule complex is stressed because the joint is moved, causing stretching or compression of the various parts of the capsule and ligaments. However, the mover muscles are not stressed because they are relaxed while another force creates the joint action. Therefore, a test of a joint's passive range of motion would be expected to generate pain for musculoskeletal injuries of the ligament or joint capsule tissue. When resisted motion of the joint is tested, only the mover musculature is stressed. Mover muscles are stressed because they are asked to contract isometrically in an attempt to create joint motion. However, the ligaments and joint capsule are not stressed because the joint does not actually move in any way, so they are neither stretched nor compressed. Therefore, a test of a resisted motion of a joint would be expected to generate pain for musculoskeletal injuries of the mover musculature. This flow chart demonstrates the proper sequence to flow when using an orthopedic test procedure to assess a musculoskeletal soft tissue injury. This test procedure listed here are active range of motion, passive range of motion, and resisted motion. Active range of motion and passive range of motion would both cause pain if the antagonistic muscles are injured or tight, but resisted motion would not cause pain in the antagonistic musculature of the joint movement. This concludes the lecture for Part 2 of Module 6.